The spa is another business opening around New York, and we want to talk about what you can do to make sure you are being safe as you might head to the spa now that it is open in some areas. And today we're talking with registered nurse Sarah Popp.
Hello.
About what you can do to ensure that you are keeping yourself safe, but also keeping others around you safe as well. And I know that it's limited the amount of people that can be in the spa right now, but if someone is leaving their house, a spa is probably a smaller space than the grocery store, which some other people are used to going. So what would you say are some things that people need to be mindful of as they start to venture out to a business like that?
So I think just in general, good practice for the time that we're in right now, just make sure whatever their personal preference is as far as masking themselves, making sure that they're, if not available, to have a sink or soap available to them to use hand sanitizer. And I think just being mindful of others and other people around them. Because the spa is a smaller type of area, we want to make sure our clinicians are safe, as well as the people that are coming into the business as well is safe.
You mentioned masking, social distancing, another part of it, especially we aren't wearing our masks because we are doing the 6 feet of social distancing that is recommended. It is important. And I think, as you start to head out and about with the warmer weather now, you see people less and less adhering to some of those guidelines. And there are still folks that are higher risk, lower immune systems that are going out and about. What would you say to people heading out to make sure they keep in mind that those folks could be in a setting like a spa needing to get acupuncture or a certain massage done?
So the type of clientele that we serve are people that have a vast array of things going on in their life. It's not just for a recreational thing. Some people come in with medical issues that they're trying to help, and using the alternative medical approach in that regard, which is a wonderful thing that we offer here. I think that those types of people that are seeking that also has to play into personal preference and making sure that you are being safe for yourself, but also the other people that you might be exposed to.
Would you recommend patients or clients keep anything on them?
The bare minimum of things. You're not going to want to bring additional things that's not going to be important to your visit with Springs.
You talk about additional things. As a female, we often carry a
Absolutely.
large purse.
Absolutely.
Who knows what else on us? We feel the need to carry a lot of things on us. Would you suggest limiting large bags like that?
I would say, again, it comes down to personal preference. I think that a lot of times, in my personal experience, large bags carry additional things that may not be needed. Or also you're setting them on surfaces that you might not even realize that you're setting them upon. So I think, specifically in this type of environment, that might be something that you can consider maybe not just taking the bag in for your treatment this time.
Do you have any words of advice for people who are still fearful taking that next step, going out to that new business as the phases continue to open?
There are protocols in place to make it a safe environment for you if you abide by them. And I think that's the important message right now.
For people who still aren't wearing their masks as much now as they're going out and about, do you have any advice for, you're keeping yourself safe, but just the safety you have to keep in mind of everyone else that's around you as well?
I think the majority of people, at least in my instance, working in the hospital and, being out in public as well, I have little children, and I think of that. I think of, the people that are not specifically myself, but that I care for. And I think that that's kind of the message that we need to all have, is that we're caring for our neighbors and not also ourselves, absolutely, but a lot of the masking procedure and all of that is to protect the ones that aren't able to protect themselves in certain ways. So I think we just have to be mindful of others, be thoughtful of other people's journeys and their experiences, because they're a little different than perhaps the ones that we're on.
We're now inside the Springs at Clifton Springs Hospital and Clinic with Operations Manager Krista Ingrick to talk about some of the changes that have been made to their facility, what you should know at home before you schedule an appointment, what has changed. Thank you so much for meeting with us here today. Krista, can you tell me what customers should expect when they come in to have a procedure done? What is different?
So I think the biggest thing that people should be aware of is that it should not look like business as usual. As you can see, our space is pretty empty, it's pretty sparse, not a whole lot of decor, no candles, no tables with displayed objects. That's probably one of the biggest things that clients should notice, is that the space should be very clean and stark in order to be able to disinfect and clean properly.
Can you tell us about the room we're in, what procedures are done in this room, how it might be different?
So in our space, we do massage therapy, acupuncture, and mineral baths. The changes that we made to our space, we cleared the table. So previously we had a table warmer, a fleece table pad, so it was nice and thick and cushy and soft. The other thing we removed was a chair within the room. Our chairs are not able to be disinfected completely from top to bottom, so we took those out. And we have a hook for people's clothes rather than setting them on chairs. Makes it much easier to come in the room, clear everything off, wipe everything down, let it sit with the disinfectant for the appropriate amount of time.
You talk about disinfecting, cleaning. What has changed? I mean, well, I'm sure everything is kept clean. I know it's a different process right now.
We are placing more attention to the detail of what are we wiping down each and every time somebody leaves. There were certain things that you would clean just at the end of the day, whereas now, every time between every single client, we're wiping down every possible touch surface.
When someone comes in, say they haven't been here since before the pandemic, someone walks in, what is going to look different, especially the waiting room you're not using right now?
Right, so clients should expect to arrive at the time of their appointment. Their appointments may be booked further apart. Whereas if they're seeing two practitioners, if they're doing massage and acupuncture, they might still be close enough together because they're not leaving the treatment room. But if in other spaces, if they're going and receiving multiple treatments or thinking they're gonna go with a friend, the appointments may be spaced very differently because you're coming at the time of your appointment, you're going directly into your room.
And what will people see as far from staff wearing PPE? What is the protective, equipment they'll see people wearing, and what should they have on them when they walk in as well?
So every client should have a mask on when they enter the building and throughout the entire treatment. The only exception is when they're face down in the face cradle on the table. They are allowed, as long as there's a drape in the face cradle, they are allowed to pull the mask down to make it easier to breathe. From a staff perspective, we're wearing masks, but we're also going to be wearing face shields. And that's for every interaction.
Okay. And as far as procedures that are available, is there anything that is now off the table just because of a safety standpoint?
So the governor's regulations are very specific about nothing can be done in the area where the face mask goes. So for us, we offer a whole service that is just facial massage. So we won't be offering that service at all right now for the protection of the clients.
Is there anything you would recommend to clients coming in, just as far as anything else that they should know, what to be on the lookout for?
They should definitely be aware of their own, how they're feeling, because if they're not feeling well, they should reschedule their appointments. In most cases, cancellation fees are being waived. Coming here is a little bit different than going to a private office. The private offices, they're having people call from the parking lot. Being that we're within a hospital, we're following hospital guidelines. When patients arrive, they are screened at the main lobby. They're expected to have a mask on. They're to come down here, and then we are meeting them and direct rooming people.
And just what do you want them to know about the safety measures that you have taken up until this point?
Being in a hospital setting, we have a lot of patients who are immune compromised. So we're always very careful about who's touching what. If somebody comes in and they're exhibiting, in the past, if they had been exhibiting some sort of cold symptoms, we had that increased awareness of making sure that every touch surface is wiped down.